Hello everyone and welcome to Health Talk. I'm your host, Jill Fraley-Dotson. Of course, Health Talk, a service of Pikeville Medical Center. Today our guests are Tondra Blevins and Vicki Kidd, who are representing Pikeville Medical Center's Women and Children's Services. These two ladies have very important jobs at PMC. We're going to delve into those departments in depth today. Ladies, welcome to Health Talk.
Thanks.
You both have very important jobs at PMC, so we're going to start with a little bit about your responsibilities that each of you have at PMC. Vicki, we'll start with you.
I am Vicki Kidd. I'm a registered nurse, been with the hospital for about 18 years. My experience had been more in labor and delivery, worked a little bit in ER. I am now the manager of the 7th floor clinic. I have OBGYN, pediatrics, and I also have a nurse practitioner with endocrinology.
Okay, Tondra?
I'm Tondra Blevins. I'm the director of OB and Labor and Delivery, and I've been with the hospital for 25 years, and my background, of course, is 26 years experience in labor and delivery. We have 6 OBGYNs, and I have at least 40 plus employees that on any given day, I could have 100 years of experience in my staffing.
You both have been with the hospital, obviously, for quite some time. Let's talk a little bit about how you've seen women's and children's services grow during your time at PMC.
We've gotten a lot bigger. Our rooms have gotten a lot bigger. We started in the old building.
We did.
Where we had very few labor and delivery rooms and very few postpartum rooms.
And we have 6 LDRs now. We do our C-sections on our own floor, so we have 2 surgical suites. We've actually went from paper charting to electronic medical record, and then of course we've come such a long way. We're doing mother-baby unit now. So years ago when we started, the babies would have to go to the nursery and stay in the nursery for 4 hours at least after delivery. Well, now they stay with the moms the whole entire time unless there's some issue that requires them to have to go to nursery. So major advancements.
Yeah.
What are some things that set Pikeville Medical Center apart from other hospitals with this type of facilities?
I think our staff, we have wonderful physicians, we have wonderful anesthesiologists, we have terrific nurses that work in all aspects, all departments.
So much experience, plus the fact that we offer so many specialties now. We have a perinatal clinic that actually comes once a month that takes care of our high-risk patients, so they don't have to travel to Lexington anymore for that. They can get that service at home. And then, of course, our neonatal unit is a big that brings a lot of patients just to us because of that, having that there with us.
Having that extra care for the little ones is so very important. Now let's dig into each of your departments a little bit further so our viewers and listeners can understand a little bit more about what each of you do at Pikeville Medical Center. We'll start with OBGYN practice first, and this is where it all begins, Vicki, for our ladies and our expectant mothers. You are the manager of the 7th floor clinic, so let's talk a little bit more about that.
We have OBGYN. I have 5 in my office. We have another OBGYN that's at the Harold office for people that are more in the Floyd County region. But in my office, we have 5 OBGYNs. We have 2 more women that's coming onto our OBGYN staff in July. I have 3 pediatricians on my floor. But with the OBGYN, it's everything from doing your annual visits to your problem visits to, of course, when you find out that you're pregnant. That's when you want to call us.
Certainly. So how easy is it to schedule an appointment? You mentioned all the OBGYNs that you have on staff. How do we go about making an appointment with one of those?
You just call our office. It's 606-218-2207. That's our scheduling line. That calls right there to the schedulers on my floor. And we go ahead and we make a new OB appointment if you are newly pregnant, if you found out that you're pregnant. And what we try to do is we want to try to get you in for your first visit at between 8 and 10 weeks. That way on that first visit, we get to do the ultrasound. You see the heartbeat. It makes it all real. And then we go ahead and we get your history and we do your lab work. And that just kind of gets it started.
And go from there. It's a very short but long process for so many expectant mothers. Let's focus on those expecting mothers for just a moment, if we would, and move over to the next part of the experience, which is inpatient women's departments.
Well, we can start out, of course, once the patient finds out that she's pregnant, we offer childbirth classes. So those are a service that are free to any expecting couple. We do those starting the first Monday of every month, and that's for 4 Mondays in a row. So, anyone can call and get those scheduled. And then, of course, once you come over to the inpatient side, you are going to be taken care of either on our OB side or on our labor and delivery. And like I said, we have 6 LDRs to accommodate our laboring patients, and you'll be laboring, delivering, and recovering there. If for some reason you're requiring a surgical procedure and have to have a C-section, then of course we do that. So you've got your staff that's been taking care of you all day long that's still going to follow you into that surgery suite to take care of you. So that relieves some of the anxiety. Once you're delivered then, after recovery, we'll send you out to the OB side, and we have very competent, experienced nurses there that will take care of you until you're discharged home.
Let's talk about calming fears a little bit, if you will, because expectant mothers, when they wake up maybe in the morning and they've gone into labor and they're so scared, when they come to the hospital, what's the first thing that you all try to do to make sure that they're calming just a little bit?
We just want to reassure them and let them know that everything's going to be okay. And of course, we always introduce ourselves to our patients and let them know that we've been doing this for many, many years, and let them know that we've been through this ourselves. And like I said, you have one nurse that's going to be there taking care of that patient through her labor. And so that is just comforting with that person being there the whole time. You kind of get a relationship, a bond with that patient.
You do get such a bond. You get such a bond with that nurse.
One of the most wonderful times of an expectant mother's life is when they come into the hospital and they're ready to deliver that baby.
Yeah.
And two, for you all, even though you've been doing it for a long time, it has to be such a special experience for you.
It is.
Oh, it is.
Yeah,
I mean,
it is.
We have stories on top of stories. Our special, whichever one of them are special, but we have special little ones. Certain things have happened, and we've had a scare, and and we're just so tickled to see them delivered and see that baby with them. Or people that have tried to get pregnant for a long time. We have special
Every
bonds
delivery
with
is
them.
special, but then you have your family that comes in, and you've got your work family that's there also helping take care of you. So that just makes it even more special to know that you've got somebody there that's worked side by side of you caring for your family.
I can imagine. I know it's so important and gratifying for those people that come in that are delivering to have that type of atmosphere when they're delivering their new little one, whether it's their first, second, or third.
Exactly.
Everything is special. We still have a lot to talk about. We're going to take a break, and when we come back, Jeanette Sexton is going to join us to talk a little bit more about the services at PMC. So we will take a break, and when we come back, we'll have more. Welcome back to Health Talk as we continue our visit with the ladies from the Women's and Children's Department, OBGYN Services at Pikeville Medical Center. Jeanette Sexton has joined us now to talk a little bit about what you do at the hospital. Been there for years as well and have seen many things change and develop. So let's talk a little bit about what you do at PMC.
Well, I've been at PMC for about 24 years, and I started out in the NICU, and that's our neonatal intensive care unit. It's been absolutely wonderful. Like Vicki has said, you see a lot of people, you grow that relationship with them and things, so it's a lot to talk about with there. But I am the Assistant Vice President of Women and Children, so that is a big role. So I'm...
Lots of people under your care, not just the
Yes.
patients, but employees as well.
Yes.
Let's talk a little bit about the NICU specifically, because that is something that you as a parent, you hope your child never has to go into. But having the ability and having the services at Pikeville Medical Center is such a plus for our facility.
Yes, it is. We've had like I said, I've been there for 24 years, so it's been 30 plus years that we've had our NICU. Our NICU is a regional NICU. Everyone comes and has a baby and they think, oh, it's going to be wonderful, but unfortunately, babies have their own mind. They can be a little sick. They can have some respiratory problems. They can have some sugar problems. They could just be preemie, just a few weeks early. And they just need that little extra care, that special care that we give to them. We also are, like I say, a regional NICU. We go to area hospitals to get babies, sick babies with it. And so our NICU, we're very proud of it.
As a parent, when you hear that your child has to go into the NICU, it is really a traumatic experience, especially after you've just delivered your baby. And then, like you mentioned, they can have respiratory problems, sugar problems, things of that nature. But we have the ability here to make sure those babies are taken care of so people don't have to go out of the area, which is so important.
And that's a big thing about it. Okay, you stay home with your baby. You can visit your baby close because you just had a baby, so you're sore.
Right.
You're hurting. You need to go home. You need to rest. The good thing about it is it's just right around the corner. You can come here and visit your baby. Babies that goes to UK or to the further, that's a few hours away.
Right.
That's inconvenient for them. So we do.
Let's talk a little bit more, Vicki, about the pediatricians that you have on staff, because it's so wonderful to be able to have those pediatricians right there in the hospital where they can go from the 7th floor clinic straight over to labor and delivery or to the NICU.
Yeah. Once the parent chooses the pediatrician, we ask the mom that when they're admitted to labor and delivery, when they're in labor, we ask who do you want to be your pediatrician? If you have other children, who is your pediatrician? If their pediatrician is the on-staff pediatricians in the hospital, they see them while they're in the nursery, and then before they leave the nursery, they go ahead and call and make an appointment for their first visit in the pediatrician's office. And that varies. Sometimes we may need to see them in a couple of days. If their bilirubin levels high, if jaundice, if there's different things that they need to see them right away, we'll schedule them in the next couple of days after discharge. Some days it may be a week. Some babies we may want to say, okay, we'll see you in a week. Usually within that first week, that we want them in the office to go ahead and establish care in the office with the pediatrician.
What about folks that may have delivered at a different hospital within our region, or may in another part of the state, or moving into our area and want to use our pediatrician services?
Yes.
It's very easy for that to happen as well.
Yes, and it's the same telephone number as if you were calling to make a pregnancy appointment or an OBGYN appointment. It's 218-2207, and that's the schedulers, and that schedules for the pediatricians as well. We have three. We have Dr. Akers, Dr. Gattacoda, and Dr. Haritas that are all on staff. You can choose. You can choose to pick one of those, or you can just say, it doesn't matter. And they kind of want to keep the same patient, to do the continuity of care. But if that physician doesn't have any openings that day and your child's sick and wants to see one of the others, we'll do that as well, because we have the records all right there.
And I can speak from experience too, having one pediatrician that sees my daughter regularly, but maybe he was gone or wasn't there that day.
Then you've got a backup.
And got a backup. And it's a wonderful comfort to know that any time that I call or that anyone else calls, we can be seen typically that day, especially if your little one's not feeling very, very good. And it's comforting to know. And the thing is too, is that the staff is there, you're there, so you see familiar faces, and that's so important when you come in for parents.
Yes, so even if your doctor's not there, it's still your same nurses.
Right.
It's still the same check-in and check-out staff. It's still your familiar. And you see those doctors throughout the hallway, even if it's not maybe your regular pediatrician. You see them, and they know you, and you know them.
They do know you, and they ask what you're there for, and they want to make sure that your little one. It is very personal. And even Tondra earlier today mentioned the family atmosphere. It is the same thing if you're in labor and delivery, and then if you're in the clinic just for a checkup or there for shots, those type things. It's a great family atmosphere, and I know, Jeanette, that's something that you're very proud of.
Yes, we're very proud of what we do at Women and Children's. And we're talking about pediatricians. We have 3 pediatricians, and they're specialists, and they're called neonatologists, that takes care of our babies in our NICU. They're specially trained. They go to take care of these babies that needs extra, that extra care. Our staff in the NICU also is special trained. They go through some special training to be able to take care of these babies that are sick and need some extra care. So yes, we are very, we have seen, like the girls have said earlier, we've seen our department grow from a few beds to now we've got our own unit, and we're very proud of it. We stay really close with Vicki, keep in contact with her, over there. So if anybody has any special needs or anything, it's already put to us, and we're ready for it when they walk through the door.
Prepared,
Yes.
lessening the anxiety of the experience and making sure it's the most enjoyable experience they have. Are there any points that we haven't discussed today that you ladies want to tell our audience today?
No, I do want to make a point about it. Is we're in the process of getting a lactation consultant, and that's one of our big things where they're breastfeeding, because breastfeeding is a big thing out there that we're trying to encourage and help the mommies, because they do kind of struggle a little bit. They're nervous and they need that extra help with it. So we are in the process of doing that. We've got a new one going to start, and so we have that extra, that other extra care, there just for them. But
I want to mention one other thing that we are planning to start doing also. At around 32 weeks, if we have moms that maybe it's their first child and they want to meet our pediatricians, we are starting to do a consult visit with the pediatricians. So like we will start mentioning it around 32, 34 weeks. It'll be mentioned by the OBGYN. Do you want to meet the pediatricians that we have on staff? And if that's something they want to do, as they check out on that visit, we go ahead and schedule a consult visit with the pediatricians now.
Very good. So that's around 32 weeks. Okay, so let's recap for just a moment if we can. How many OBGYNs do we have on staff?
As of right now, I have 5. I have 2 more coming in July, so we will have 7.
Wow, that's a wonderful
Well, and actually,
opportunity.
I lied. That's in my office. I'm sorry, I keep forgetting. Dr. Maggard is in Harold, so
Right.
there's actually 6, and then there'll be 8 in July.
Yeah. And the pediatricians that we have on staff.
Pediatricians, I have 3.
Okay.
Mm-hmm.
Very easy to make appointments with any of our OBGYNs or our pediatricians. We don't want to forget the aftercare for our little ones. So let's give the number one more time that people can call and make an appointment.
It's 606-218-2207.
2207. And if it's time for delivery, they can come, Jeanette.
Yes,
and
they can.
Everything's going to be so easy.
And during the childbirth classes, because I know that was mentioned, they get to have a tour. They get to come and look and see where they're going to be at, how the process is going to happen, where they're going to begin at, where they're going to go to, where they're going to end. So, we try to make them comfortable with it.
Yeah.
So, yes,
As I mentioned earlier, it seems like a lifetime in that 9 months
It
that
does.
you're getting ready to deliver, but really it's a short time. It goes very, very fast. So
does.
what a wonderful opportunity to meet the pediatricians, to come to the childbirth classes, which are so important.
Oh, yes.
So important, not just for the mamas, but for the daddies too.
Yes. Well, you have anesthesia coming there and talking to them about pain control. We have the pediatricians come and talk to them about any concerns that they may have with that. So there's a lot in our childbirth classes. So we get them ready.
Make sure you sign up for those. And of course,
Yes.
if they have any questions, if expectant mothers have any questions, they can always call
Yes.
the hospital and get all the information that they need. Let's give that number
Yes.
if we could.
It's 606-218-3524 if you need to call the labor and delivery, or to the office is 606-218-2207.
Jeanette, Vicki, and of course Tondra Blevins joined us earlier in the program. Thank you all so much for being here, and thank you for what you do for our new families or families that are continuing to grow in our community. It's such a wonderful opportunity, and it is an advancement in our community to have the services at Pikeville Medical Center that we do.
We're very proud of it.
Yeah. Thanks so much for joining us, ladies.
Thank
We
you.
appreciate you. And thank you for your time today. I'm Jill Fraley Dotson for Pikeville Medical Center, proud member of the Mayo Clinic Care Network.